Okay, healthy heart and bones. So this is just one of those sentimental thought. I just thought I put that in the opening, kind of demonstrating what symbolism we use for the heart in our arts and in our day-to-day activity. The question you may ask is, what is it? At the level of science, it is an organ. You know, when you're talking about the heart, if you had to describe what it is by itself, that itself can comprise a book. But at the level of what we call an organization, when you look at things such as a cell, a tissue, the heart is an organ. And in its function, it does that like a pump. Illustrated in this diagram, just a replica of what a pump is. But in this particular pump called a heart, whatever it is taking out in terms of the circulation, a lot of times is returning, because whatever it is circulating is fulfilling a purpose for the body. That said, for most people, the heart will be located on the left side of the chest, what physicians would normally term as the intercostal area between the fourth and the sixth. But with few exceptions, you could have the heart on the right for few people. I have only seen that in about two persons during my own practice and lifetime. And most of the time, you would, if you were not told, you had to be very, very, very astute to pick it up if somebody was presenting to you for the first time, because majority of people will have their heart on the left side. Just a brief anatomy, not going to bore you with that. It's composed of muscles generally. Okay, so it's a pump that's muscle because it has the ability to contract. So we call it a contractile muscle. And besides it having this muscle, it has some of these yellow things you would see around it. This is actually for illustrative purposes, which is a collection of tissues. They are like generators on the heart. They are nodes on the heart. And these are actually very important. These nodes actually, a lot of times, determine how fast or slow your heart beats. For instance, this one up here called the SA node beats faster than the AV node. Now, sometimes when people start getting older, as much as we're talking about a healthy heart and healthy bone, just small nuances, you could see that some of these nodes can be diseased, and then the person can have what we call an irregular beating of the heart or an arrhythmia. So we mentioned the fact that it's made up of muscles. Coming into it and leaving it are what we call vessels, and they are called great vessels because they are different from the arteries and veins you and I have got in our hands and legs and in our guts. These are great vessels because they are of great size and they hold a large capacity of blood. Be it the one coming into the heart on the right side, or be the one leaving from the left ventricle. They are great vessels. That is the brief. What you have mentioned as well in terms of disease states, there are vessels that feed the heart. So just like some of you are parents and also feed or provide for your families, you also cater for your own needs. The heart also needs a blood supply itself, and it has some arteries which are not shown here, and they're called coronary arteries, but they're not demonstrated, but just for for information purposes. So you may ask, what are the functions of the heart? We mentioned a little about it when we talked about circulation. Some of you already know this, but you ask yourself, what are we circulating? And primarily what we're circulating is blood. Okay, so blood coming from what we call the systemic circulation from everywhere but the heart, and from the heart and brain circulates to the legs, to the gut, and everything comes back to the right side of the heart, and they leave the heart, go to the brain, go to every other part of the body, and they return. And the body has to maintain, or the heart has to maintain this beating at a certain rate based on the individual's requirement. I was telling the little children the other day, while I was actually attending to them in the children's department, that if there's something that you could be grateful for, it's the work your heart has to put in. If on average your heart says beating even 50 times per minute, that means in about an hour, you've got about 3,000 beats. And in 24 hours, you're talking about over 60,000 beats. And on average, people's heart will beat between 60 and 90, and sometimes over that when you have certain diseased states. So that's what it does with regards to circulation. It is circulating blood. And what's the purpose of this circulation? You may ask yourself. It has to distribute, it has to clear unwanted metabolite or unwanted wastes in the body. And this might include like of carbon dioxide, which the body generates through its activities. So the blood picks up CO2 or carbon dioxide from the system. It goes to the heart sends this blood to the lung, and the lovely lung and its tissues take away some of the CO2 from the blood and give us back some oxygen, and then we're able to have something to get by, some fresh new oxygen. All this oxygen we're breathing, the heart has to keep that blood in circulation to pick them up. It also has an immune function, okay, whereby it has to pick up, whereby if you did have an injury, say or an inflammation per se, the blood actually, the heart sends most of the blood circulation to that area of inflammation, transporting inflammatory cells down to the area. And by sending inflammatory cells, it sets up our immunity to confront some of the challenges or some of the pathogens or some of the insults that may have hit the body. And I did mention some of the sentimental values. And now when people actually describe love and things like that, they use the heart and things like that. Just trying to make sure that, sorry. So when we say a healthy heart, what do we mean? It means so much, you know. If you spoke to a cardiologist, a healthy heart could be relative, you know. A healthy heart for somebody who was born with a congenital condition whereby you say, for instance, a valve wasn't working well and had to be repaired. Whatever that heart could do under that limitation might be deemed a healthy heart. But if you looked at the background of that slide, it will show you some of a prototype of what waves we pick out when we check the heart in terms of its pace and its electrical activity based on those little tissues I showed you earlier on, the nodes. That's an electrocardiogram. So if you're looking at the generality of a healthy heart, you could look at it from maybe from simplistic perspectives. Are you able to do some of the things you could do? Say maybe climb up the stairs without trouble, lie down on your back without trouble at night, or breathe uh, freely when you're walking, or if maybe there was a cause for alarm such that you had to run, would you be limited in any way? So if you didn't have any problem with this, at least from the perspective of the heart, you could say subjectively, my heart is okay. But in an objective way, you say somebody came to the hospital uh, with a query regarding the state of their heart. There is a perspective to look at it from imaging. There is, and when we say imaging, you're talking about the likes of ultrasound to look at the structure of the heart. The structure definitely might be okay, but it doesn't still mean that it doesn't mean that the heart is entirely healthy. But it is satisfactory and encouraging if, say, looking at the structure, you find the heart to be healthy after you've done an echocardiogram, which is using an ultrasound to look at the heart. If you went to the hospital with a concern regarding a healthy heart, the health professionals will want to know, do you have pain? One devoid of pain that is characteristic of the heart will attribute also towards a healthy heart. And we talked about functionality of the heart. How far can you walk? Is that preserved from what we'll call your baseline, say in the last few weeks and the last month? And then I talked about normal pacing. For somebody who doesn't understand, this is referring to what you would see when you did a heart trace using a device such as an electrocardiogram, because sometimes the structure might look physically okay, but you might have issues with the pacing. Hence the reason I showed you some of the anatomical correlation. And with all of this, sometimes the parts we cannot see, like the coronaries, can be viewed, be it with CT or direct visualization with interventions such as what we call an angiogram, whereby a probe is put into the vessel, goes straight into the heart, and looks for the patency of these vessels. So a healthy heart, I would say personally, is a harmony of structure and function. Basically, the heart looks good. Structurally, the valves, the muscles are contracting well. The nodes are in good state. The coronaries are okay. And then it still does its function. So it's a combination of both. That said, you ask yourself, what are the risks of a healthy heart? What are the things that threaten a healthy heart? And if you read the textbooks, you would read about what we call modifiable and non-modifiable risks. Now, having done some presentations on behalf of the Health Ministry Department recently, we've been going over some of these risk factors because they do not affect only the heart, but the heart being a component of a broad group of system called the cardiovascular system, in which the brain is also involved and most of the vessels. These risk factors also play a role in the state of a healthy heart. Sadly, some of them are non-modifiable. And when we say non-modifiable, it means that there's nothing I can do about them. There's nothing you can do about them, except maybe things changes over in the future, which I don't see happening. So when we talk about age, the older people get, the greater their risk for an unhealthy heart. Most of the time, the threshold we will use when we use certain scores, we start looking at scores such as 50. age 50 and the likes. But that doesn't mean that somebody who is 35 or 37, if they had risk factors, couldn't have an unhealthy heart. They can. But if you looked at the global general population, we look at the older the age of the individual, the higher the likelihood of heart disease. Another non-modifiable risk factor is gender. It is believed that the female hormone estrogen is a protective factor. So hence, you tend to see less of an unhealthy heart in younger females relative to men. So because of the protective effect of estrogen, we have less of, especially when we talk about the likes of coronary artery disease, which is a disease of those vessels that feed the heart. And what you've mentioned, I thought I'd mention it. It's usually a very good correlate of some of the instructions you hear on the plane, whereby you put on the mask on yourself before putting it on some other person. So basically, if the coronaries of the heart are not working well, so no matter how much it works well to feed others, it doesn't fare well itself. Fortunately for those in the female gender, on most occasions, for premenopausal women, they have a protective effect of estrogen from coronary artery disease as compared to their male counterparts. So a non-modifiable factor is your gender. So if you're male, then you have a higher risk, especially of coronary heart disease. But considering what you have mentioned and what you have noted for those who might be seeing this later, not live, is that we're speaking about a healthy heart, which is a very broad subject. Now, family history, you may not be able to change. Some people with familial health conditions that predispose them to cardiovascular disease might not be able to influence their heritage or their family. And then when you talk about race, you talk about those who are of the African or African American race. These lot have a great predisposition compared to their counterpart races for cardiovascular diseases. Modifiable, long established, is smoking. And I think at this stage, it's become a no-brainer because of the many researches and many evidence that we have that it's actually now it's been legalized in terms of smoking being prohibited, be it in public places, because of the appreciated public health risk associated with smoking. Hypercholesterolemia. Now, with regards to hypercholesterolemia, this is something that I would appreciate everybody to remember. It's not necessarily your level of cholesterol, but the quality of your cholesterol. I repeat, it is not necessarily the level of your cholesterol, but the quality of your cholesterol. And what do we mean by that? Normally we're expecting that your cholesterol level, say, be 5 millimole. But say you had a cholesterol of, say, 6 millimole, and of that you're having a high density lipoprotein or a HDL component of it of, say, 3. And you had the low density, which is the cholesterol that is most of the time implicated in being involved in coronary artery disease, say about within the threshold of normalcy, and the other components like triglyceride within the normal, then you're not concerned as such because you have a healthy component on the higher side, which is the high density lipoprotein in this particular case. So most of the literature, especially if you looked at the likes of UpToDate, which is a great resource, and I recommend for everybody if you have access to UpToDate, the quality of your cholesterol is what matters. The other issue is body mass index, which in another way put is a proportioning of your body mass, of your weight, basically, to your height. So we're taking into consideration how much you weigh relative to your height. Is there a great proportion in that? And this actually, this actually has been identified as a risk factor for many cardiovascular disease. It is also an indicator for risks such as diabetes based on where you are on this index. Now, I think thought process is also being driven towards not just your body mass index, but how morbid or how disease prone is your body mass index. Now, the body mass index, for those who do not know, is calculated using the weight in kilogram divided by your height in meters squared. So I repeat that, and I keep repeating that each time I have to mention the body mass. It's your weight in kilogram divided by your height squared in meters. So say I am now about 73, 74 kilogram, and my height is 1.7 meters. So I would multiply 1.7 by 1.7 and divide whatever value I get. I will use that as a denominator to divide my weight, which will be, say, 74 kilogram. So say maybe your height squared is, say 3, for instance, and your weight was 60 kilograms. So your body mass index will be 20 kilogram per meter square. So the advised or recommended body mass index is between 18 and 24, 25. So if we're anything between 25 and 30, one is overweight. I'm overweight by, say, a couple. I'm not proud of that, but that's where I am now. But what you've mentioned as well is to ask yourself, how morbid is your body mass index? Now, I think what we mean by that, you'll be more concerned about your body mass index if you're trending upwards in your body mass index, say 28, 29, and then you've got a high blood pressure, and then you've got a diabetes, or you have risk factors like, say, maybe family members who've had a heart attack or coronary artery disease, say, before their age 40. So, and then on the flip side, body mass index less than 18 isn't necessarily, it might not have huge implication on a healthy heart, but predisposes you to other health, detrimental health condition, especially if that weight is due to maybe an eating disorder, for instance. Diet actually has been deemed as number one risk factor for morbidity. Number one. Actually, it's from what's been quoted, it surpasses even smoking. And in this particular case, it's a diet that is rich in saturated fats. And actually, because of this particular observation, I'm kind of cutting down on some of the oils I use. So I would normally tell people that since my 3rd year of medical school, I have barely bought butter. or margarine, because a great deal of them are saturated fats. And if you want to get an imagination of what this does, you just think about some of the manholes or some of the sinks that get clogged due to oils which are being put in them. It does similar things to the vessels, basically. So the problem with saturated fat is that the body hasn't got mechanisms of clearing them. So they deposit. They go to some of those great vessels. If you did, if you looked at the human being who was dead and you did an autopsy, you see a lot of people inside of the big vessels. The aorta is white all through, and that's a lot of saturated fat that's clogged the walls of those vessels. Now, the problem is that when they go to the smaller vessels, like the coronaries, they block it and the heart cannot be fed with blood, and thereby causes injury and the predisposition to diseases and morbidity in this case, and even death. Exercise is another modifiable factor. It's actually been deemed that a lot of people from some US data are not even able to get up to 20 minutes of exercise, active exercise, be it walking, just walking, 20 minutes of exercise daily. Recommended if you are doing a moderate to intense workout is about 75 minutes per week and 150 minutes if you are doing mild exercises. So our exercises could just be a walk for people who swim. We know what to do, but it's very unfortunate that our lives, be due to the way we transport ourselves, due to our way of work, whereby we are no longer gatherers. We don't go to the farms to gather things. We can go to the shop and pick things up. We are less active relative to our forebears. So this is a modifiable risk factor in order to maintain a healthy heart. And these are the risks. So it's been split into non-modifiable and modifiable there for us. These are some of the numbers which I looked up in the Central Statistics Office. This is just for Ireland, actually. So for every 1,000 persons that died, that's 1.9, two of them died as a result of cardiovascular disease. The gross of people who died due to cardiovascular deaths, which will include the likes of strokes, were 2,485. And I think of that, actually, a heart disease, just the heart contributed just slightly over 1,000 from the Central Statistics Office. I'm trying to find 1,088, the number is actually. So contributing about 26.6%. And when I was astounded looking at, it suggested that this, together with cancer, contributed to half of the deaths on our island. So stating the facts for a healthy heart. So you give yourself a better chance of, a healthy life if you are able to maintain a healthy heart. So the question is, how do we do that? Or what are some of the recommendations? They are age-long, actually. The question is, what am I doing myself about that? So just as we've seen, if you know what causes a problem, then you probably know how to confront it. Hence the reason we highlighted some of the factors that actually contribute to an unhealthy heart. And if you know them that way, you could oppose them by living lives that are better. I think top on my list will be actually avoiding saturated fats. Top on my list. I don't think I've seen anybody who doesn't like butter, for instance. I eat it indirectly if you had to eat some of this processed confectionery, but I haven't bought it in a very long time. And I'm so sure that's one starting point. And I think diet should be way up there in terms of my list, in terms of recommendations. So we're encouraged at least about 5 servings of fruits. I haven't really appreciated what that materializes as, but I think as much fruits you can have, the better. Nuts are encouraged. I particularly would not encourage peanut, but I haven't seen much of literature suggesting against it particularly. But some nuts, 2 to 3 servings of nuts daily, I encourage. Avoiding red meat, especially processed meats. And most of these processed meats are actually done with red meat. We have a little bit of a privilege in terms of the fact that some of our families of faith would recommend vegetarian diet for people. And those who, you would be surprised, up to date was actually quoting one of the Adventist study it stated actually, and it was noting how much of a health hazard processed meat was in terms of some of their cohorts. Now, worthy of mention though, none of these in isolation will do the job. So that's why we sometimes get it wrong. Say, okay, don't eat processed meat, or go ahead and indulge in eating cabbage every day. That would not do it. So it's a holistic approach whereby you engage in exercise, you have you're cautious in watching your weight over time, to make sure that you're staying within the confines of normal weight. Smoking, you're staying away from both passive and active smoking. It's unfortunate that certain people would not smoke, but they actually have health issues due to passive smoking, be it from those they share accommodation with or their loved ones. And that's something worthy of consideration from some of us. Preventing and treating this predisposing condition. Now, you must know the current understanding is if you've got diabetes, it's just diabetes sometimes is more like equal to cardiovascular disease. That's how terrible that condition is. With all the knowledge we have about it, if you have diabetes, the first thing that comes to mind is what it does to your vessels, especially to your coronary vessels. And that's the reason anybody goes to the hospital, they've got diabetes and they're talking about chest pain. The physician, the nurses gets concerned. Already your scores, your heart risks are up. So treating predisposing conditions like diabetes is of utmost importance. And hypertension, especially for those of African heritage, hypertension is a huge risk for unhealthy heart and coronary heart disease. In terms of the heart, the issue with hypertension is that the incessant increase in pressure causes the heart muscles to become stiffer. And you remember how we said it's a contractile muscle that acts as a pump. If you've lost your ability to contract properly, then the heart has lost a great deal of its function, and that will compromise the individual. So you have a predisposition with the hypertension to a thickening of the wall, what we would sometimes call the hypertrophy of the heart. And that predisposes the individual to poor health state and poor quality of life, because you take, for instance, some of the things we take for granted is our independence. Imagine someone having to move their bedroom maybe from a first floor to the ground floor, and they are never able to go up to the first floor simply because the heart function is compromised. So preventing and treating predisposing condition, if applicable to the individual, is also very important in maintaining a healthy heart. I think that's that for the heart. We use this bit of time I've got now to see how much we can cover with the bones. Now, I'll appreciate you could write things down in terms of questions. I'll be very pleased to take any questions. I'm usually very curious as to what people have on their minds regarding what they hear regarding health matters, especially in this particular case, this presentation. So if there's something that you were curious about regarding a healthy heart, which you looked forward to hearing and you probably didn't get it, at the end of the presentation, please do not hesitate to question. And I'll respond. And if I don't, that's the beauty. I'll tell you that I'll get back to you. So that's so please feel free at the end, and we'll share time for question and answers. So this is a section for healthy bones, and bones, we define them usually in medical terms as connective tissues. There are about 206 of them in an adult, actually, when all of them are fused. I haven't taken the opportunity to count each of them, even through medical school, but yes, we would have studied just about all of them. 206, and they act as a connective tissue. There's practically very few parts of your body that you can touch without it being associated with a bone. What are the functions of it? It's a structural support. So you can imagine all of the muscles we're carrying. You can imagine all of the tissues we're carrying inside. They are hanging on the bones. And without the bones, I don't think we'll be able to carry all of these things that we move, called our body. It also helps because it's a connective tissue with movement, because most of your feet, your hands have bones. There's something called, which we take for granted, but you find it in disease, your ability to turn right and left, to turn the hands this way and that way. It's called supination and pronation, okay? It's due to some of the bones you have up here. They switch position, and you're able to do that. It's a very unique and brilliant. We take it for granted, actually, but if you did have some pathology, you're not actually able to move it. So it does help in movement, but because they are invisible to the eyes, you can only feel them, except you can see them only if you've got an injury. You may not be able to appreciate. So it does help in movement. It is our main storage area for calcium. Most of your calcium, most of your phosphates are stored in your bone. You might ask yourself, so what does the calcium itself do? The calcium does so many things. The calcium helps certain enzymes to be activated. When you have bleeding in your blood, you have bleeding after a cut or an injury, calcium is involved in the process that helps to bring up those cells that causes what we call a clot to prevent further bleeding. So most of these are stored in your blood, in your bone. It has metabolic function and immune function, by saying that as well, in terms of the fact that the bones are the source of your blood, one of the sources. Sometimes the liver is involved, especially when you're younger. But the primary, the older, and the adult, the bone is the source of your blood. And your other blood tissues, your white cell count, for those who will be familiar with those components of blood. This bones does it. If your bone fails, which happens when certain people who are older and predisposed get it, be it through myelofibrosis, then they become dependent on blood transfusion. So bones are very important. And I'm grateful for this presentation because it reiterated that actually we do have a specialty totally dedicated to the bones in the form of orthopedics. It also offers us protection. We talked about the heart being on the right side of the chest, between the fourth and the sixth intercostal space. What that means is that you cannot get to the heart without actually opening up the bones of the chest wall. It protects it also from be it injuries such as the knife and then, the knives could get through and things like that. But we have an added protection of many of our tissues and organs because of the bones. For those, if you look the hip area, most of our gonads are protected because of the bony structure which we have there. Your back, if you think about the spine, it is encased in the vertebra, such that before you can get, even with a pin, when we do what we call the lumbar puncture, it's a job, actually, it's a skill to be able to get into those spaces. And that's some of the protective effect of your bone. Still talking about healthy bones. So what are the sites of the bones that are being threatened? Where is it that, while we're thinking about a healthy bone, what constitutes that healthy bone? It means that your bone marrow function is intact. The bone mineral density, which is not only about the size, but the nutritional value of your bone, is intact. And this is actually, in terms of the bone density, just learned that develops even up to about age 40, depending on how you have engaged with it. We will talk about that. Areas where that could be affected at the likes of bone density, and this is where maybe things like osteoporosis comes to play. If the bone mineral density is compromised, the bone becomes less healthy. The bone becomes more predisposed to fractures, which is the main, which is the most feared outcome of osteoporosis. The bone marrow function in terms of healthy bone, if you did have abnormal cells growing into the bone marrow, they might compromise the bone marrow function, and that way limit our ability to function as an individual. Because if you're not getting adequate red blood cells, then you're probably not going to be able to carry out your daily functioning, not even being able to sit down peacefully, because you're probably going to be out of breath because of your low blood count, and that will impair on the quality of life. Some of the threats that the bone has includes infiltrative diseases. And in this case, we're talking about the likes of cancers, a lot of cancers that are extrinsic to the bone, which means they are not being generated from the bone, likes the bone. Say, for instance, prostate cancer, it does like the bone. Lung cancer, they go to the bone a great deal. So most of the time, people pick up some of these cancers. Physicians are looking at the bone windows to see, is there any consequence or any disease of the bone? Say, for people with prostate cancer, some of them might not have any symptom with their prostate, but it will be the pain that they'll be suffering will be due to a spread or what we call metastasis to the bone. Now, certain people can have a vascular compromise of the bone and what we call avascular necrosis. So, if you cut out blood supply to most tissues, they will die. which makes us appreciate yet again a healthy heart. If you cut out circulation to the bone, and this usually happens in the bones of the hip, the femur, the head of the femur, you can have what we call a vascular necrosis. And there are so many risk factors, which we're going to be talking about next, for some of these threats to the health of the bone. Diet, we mentioned, is an important factor, not just for the heart, for the entire well-being of for most diseased or persons with different conditions. If you look carefully, there is a dietary determinant or component to it. And that doesn't exclude a healthy bone. Now, we talked about the majority, a great component of bones being calcium. You ask yourself, how does someone get involved with a hypocalcemic diet? A diet that is very poor in milk. Now, a lot of vegans, those who are pure vegans do not take milk. And these need to supplement, or this cohort need to supplement their nutritional intake of calcium, because milk is primarily rich in calcium. Hyperparathyroidism, which, as it were, the parathyroid, I'm so sorry I had to put in this medical terminology, but I don't think there's no substitute name for this organ called the parathyroid. It's behind the thyroid glands in your neck. They are a huge regulator of bone. How much bone is formed and how much bone is broken down. How much bone is formed and how much is broken down. The parathyroid gland plays a huge part. Now, if you have it hyperactive, so you have so much of it, it goes to those bones and it breaks them down. And that compromises the health of your bone. Hyperthyroidism itself, the one just in front of the neck here, also by itself also contributes, can also contribute to an unhealthy bone, because with hyperthyroidism, what you get is that every part of the body is worked extra. It is deemed sometimes as an igniting hormone for the body. It keeps us active. It does so much which people actually do not appreciate. So when it's very hyperthyroid, the heart is racing, the sweat pores are active, the bones are being broken down, everything is working extra. Hence, you get a more what we call bone turnover and unhealthy bone ultimately as a result of this. Hypogonadism also plays a great deal. For what that means is that for the men, we have gonadal hormones that are secreted from our gonads. From women, it is estrogen and the likes of progesterone. But in men, it is testosterone. If you had a deficiency of testosterone, there's a huge risk immediately conferred on the individual to have unhealthy bone through a very low bone mass density. And sometimes this can be cumulative. You ask yourself, how can somebody get hypogonadism? It can be due to conditions in the brain. It could be due to diet in the form of alcohol. A great deal of alcoholics have hypogonadism, and this predisposes them to the likelihood of having poor bone health. Chronic kidney disease, kidneys, which I love, is a huge player. And you ask yourself why. One, the kidney is involved in the synthesis of active vitamin D. And why do I say active? It is not independent. It is a process that starts from your skin with exposure to sunlight, and thereafter the liver, and after the liver is put in certain substrate, the kidney activates vitamin D. Most of the time, the parathyroid hormone, which you're saying, which I talked about earlier, has to knock on the kidney to give it vitamin D. A couple of us might take vitamin Ds in this part of the world without actually relating to what it does. It does so much, because the calcium you get from your milk and the gut, which you get from your milk and you ingest, for it to be mobilized from the gut, you need your vitamin D. Without a vitamin D, that calcium is laid to waste. You cannot pick it up and take it to the bone, or take it to the blood vessels, or take it to the enzymes. You need vitamin D, where it picks up both calcium and phosphate. So in chronic kidney disease, a lot of times they lose out on the enzyme responsible for the activation of vitamin D. And that individual becomes deficient. So most nephrologists at certain points of renal impairment will give individuals not just vitamin D replacement, but will also give them a medication to suppress the parathyroid hormone. And I'm sorry if I'm getting into too much details, but just trying to help us, those who might not necessarily be in the field, to appreciate why some of these things are listed here, rather than just making a list, so you can have a little bit of an idea. Then the medications, some anti-seizure medications play a role. Certain contraceptives play a role, because if they inhibit the estrogens in the womb, then they can compromise the health of the bone. And there are certain other conditions which we did not even mention. Also, for some of us here, poor or low exposure to sunlight predisposes us to low vitamin D, thereafter low calcium if we're not careful, and unhealthy bones, as it were. So those are some of the risks that you have towards unhealthy bone. And by looking at this by itself, you have a bit of idea of some of the things that can be modified in order to achieve a healthy bone, or to maintain a healthy bone, whichever the case may be. So what are our recommendations? It's actually nutrition or diet, exercise, and supplement. Ask yourself, what are those nutritional intake? We're expected to take about 1.3 grams of calcium daily. That's our recommended intake of calcium. Most of this come from dairy, hence what you have on your skin, on the screen there. Dairy products are very rich in calcium, as it were. Cheese and the like. For those who eat cheese, I don't think I eat that much cheese. And that also can be a challenge for people who may have like lactose intolerance, as it were. But this will be your primary source of calcium. Exercise, very interesting. I don't think I've actually got this from medical school. So we talked about the bone mineral density or bone density, which actually you build up to the age of 40, irrespective of your gender. It's deemed that the more you engage in more weight-bearing exercise, the more you strengthen the bone mineral density. Together with diet, is not in isolation, but primarily people who actually exercise regularly prior to, especially in the case of women. Why do I say that? I think there is a great predisposition for reduced bone mineral density in women, especially postmenopausal state. In fact, it's deemed that actually once women start, once they start menstruating, menarche, they start losing bone density. But if you're exercised actively prior to age 40, and even after that, you're going to build a great deal of bone mineral density. Your bones are going to be denser for it. And that's the reason why it's written here, swimming is non-contributory, because it's not influenced by gravity. It has a great deal of health benefit. So, if there's a takeaway from this particular presentation is that, as much as your calcium is important, your level of weight-bearing exercise is important. And you will see a lot of women who live in parts of the world where women are not allowed to get out, who live a sedentary life. They could come complaining about what sounds like muscular pains and niggles, but it's actually bone pain due to not only poor density, but the fact that the bones are not actually exercised, and they are not as healthy relative to those who would engage in physical activity where gravity is employed. And then supplements, obviously. I need this personally, because I tell you personally, I did have my blood checked once, and my vitamin D was almost non-existent. So for most of us here who do not have adequate penetration of sunlight, and for those who are darker skinned, it might take a great deal of activation for them to have their vitamin D quickened by sunshine, and thereafter the kidneys. We do need vitamin D supplements, and calcium, as the case may be. Now, you don't want to go taking calcium if your calcium level is raised, or you do have a condition that predisposes you to high calcium, or you're taking medication that actually causes you to have high calcium, or maybe you have a lot of a pathology associated with stone formation, of which calcium is a major component of it. You want to be very careful and have consultation with your physician, your GP, with your doctor in your primary care facility to have a look at that. But a great deal of us actually, one of my senior colleagues would have said, we should stop checking vitamin D in Ireland and everybody should just get vitamin D. But that was just a bad idea. I wouldn't recommend that. But lots of us are likely vitamin D deficient, and we should have that checked and supplemented as appropriate in order to maintain a healthy bone. I think a great deal in summary, is the fact that for us to function well, be it from the point of view of what we've discussed, the heart and the bones, you do need to be mindful of our diet. And they are of different sorts, depending on which one you consider. If you're thinking about the heart, think about less processed meat, think about less saturated, think about, in terms of things about avoid on saturated fats, exercise. And why we like to dwell, I do not like to dwell on what we shouldn't do. But in terms of the heart, if we're exercising regularly, if we're eating poorly unsaturated food, like olive oil will be great for polyunsaturated. If we're eating a lot of plant-based food, and that goes to myself as well, thinking about fibers, and brown rice and the like, when we're talking about fibers, it will do a great deal to fare well. And you think about your bones, to exercise them as well, also in keeping with the heart, you're going to do well. being mindful of our geography, vitamin D and calcium where appropriate. And I leave you with the thought that I will praise my own God. I hope you will do the same thing, for I am fearfully and wonderfully made. Marvelous are your works, and that know very well. From Psalms 139:14. And with that, I'm so sorry if I've gone too much beyond the time, and I hope ye made sense of anything I've said. And if you don't, I'm open to questions. And thank you so much for your time, for those of you taking the time to attend tonight. God bless.